All right. Hello, everybody. We are excited to have this conversation with you because we know that there's all kinds of communication, all kinds of buzz, all kinds of press about AI, artificial intelligence, machine learning, all these vague and nebulous concepts. And it's exciting in both of our careers that, hey, people are interested in this stuff, but we want to give healthcare leaders the ability to separate the real from the false, to give the tools to really understand what is this new technology, what are the implications that it has for my organization, and really as practitioners ourselves, we wanted to share a little bit about what's going on behind the scenes so that people have ways to really effectively compare and evaluate solutions. So the master of ceremonies will be Joe Schmid. Who's our Chief Technology Officer. Any greetings for the audience, Joe?
Yeah, thanks everybody for coming. We're super excited to have you here. We put together a lot of great material. It's been fun doing this with Chris and the team. We've got a lot of great stuff to show you. We're excited to have you be armed with a lot of knowledge to go and navigate this particularly complex space.
And on both sides too, we appreciate your commitment. You're going to see in these 4 sessions that we have, just a lot of the reason that we do this is we want there to be a baseline level of education, because within healthcare, when you look at AI solutions that Facebook and Netflix and other organizations outside of healthcare are using, they're optimizing for things like clicks and video views and things like that. But we're really focused on, hey, how can we take an opportunity with these technologies and help healthcare leaders use it to improve lives? So with that said, I wanted to just jump into a little poll here where you can, we just want to see what your level of familiarity is with AI solutions. But ultimately, while you're filling that out, which is just one question, so it's not very much to fill out. But what we're hoping that you are able to leave the session with is a way to clearly understand what AI is, what some various subsets are, such as machine learning versus traditional filtering and things like that. And then more importantly, understand, hey, what kinds of solutions have the best business impact where? When should I be thinking about this type of solution or something that tracks this kind of information versus another? And what are some metrics that I can use? What are some ways that I can start comparing different projects, different vendors, different approaches, different scenarios? We want to give you the ability to measure and handle all that. And what you're going to see is, of course, the video content, the live content that we deliver to you today. But after each session, there's going to be some takeaways that we are going to leave behind with you to help cement the learning. So we've got about 64% of the folks logged on today, and I'm going to go ahead and end the poll. You'll be able to see the results just to see, hey, where do I stack up among my peers? Just a quick preview on it. We have 31% who have led or participated on health AI projects, 19% who are evaluating solutions, and 50%, about half, who believe that they'll make AI-related decisions in the future. The most important, one very important number is the very bottom. I don't think my organization will ever adopt AI technology. Solid 0%. And we agree, like as healthcare leaders, as this technology proliferates, the reason that we're here is because you're going to make a decision in AI technology. So these are kinds of the tools and learnings to not teach you Python, data science, SQL, R, get a PhD in that, but understand at a strategic level, understand how to make decisions in this area without necessarily understanding like the code and the underlying technology. But with that, I just wanted to hand it over to Joe, who's going to go ahead and get us started in this kind of brave new world of explanation and understanding of AI.
Yeah, thanks, Chris. And thanks for the audience for your participation in the poll. I think the last one is really telling. We all know that AI is coming. We're at different stages of our prep and adoption, but there's nobody who says it's not going to make an impact. I do want to emphasize that last point that Chris mentioned on this slide, which is this is really meant to be approachable. We're going to explain things in plain English. We're going to avoid technical jargon. So we really want to make this something that you can approach and take away a lot from. So with that, let's take a look at our syllabus for the course. Today's session is going to be very high level, kind of strategy focused. We're going to give you a new way to understand AI. We're going to talk about the impact in healthcare. We're going to give you some examples on how to approach it. And our takeaway is really a concrete strategy guide with recommendations on how to start and apply it in your organization. As we go, we get a lot more detailed. Session 2, we really dig into the difference between AI and machine learning. We give you a framework to understand machine learning. We talk about data sources and how you can prep data to train models. Again, all at a non-technical kind of conceptual level. Session 3 is our most detailed one. We're really going to give you the fundamentals of understanding model performance. This is going to serve you well, understanding thresholds and trade-offs between things like false positives and false negatives. And you're going to walk away with an ability to understand how models work and perform. And then session 4, we really bring it back to the practical, how to put it into practice. We're going to give you some low effort and low cost ways to get started. And the AI is a landscape that can be very confusing. There's a lot of hype out there. So we'll help you cut through a lot of that and navigate that vendor landscape. I'm going to actually jump out of slides for a second, and I'm going to give you a sneak preview of one of the things you're going to learn. After sessions 2 and 3, you're going to be able to understand everything that you see on this visualization. This is an interactive tool that we put together to understand model performance. You can actually play with this. You can adjust thresholds and look at how it impacts things like false negatives and false positives. This curve you see is something called a ROC curve. And we're going to break all this down, and we're going to do it in plain English. We're even going to build a ROC curve by hand in Excel. And I promise anybody on this call can understand this. We're going to do it using elementary school math. So you're all going to go away with understanding everything on this slide. And we're really excited about putting that in plain English for you. And we feel like that's going to serve you well as AI takes over the world, much like software has taken over the world. Models and predictions are going to be everywhere. So being able to understand model performance is something that's going to serve you well for a long time. All right, and with that, let's start our session 1 content. So the first thing we're going to do is we're going to introduce a new way to view AI that we think is really simple but powerful. And before we get there, credit where credit is due. This idea comes from AJ Agarwal. He's a professor in economics at the University of Toronto. He and his co-authors wrote a book called Prediction Machines that I really recommend for non-technical folks to understand AI. And his idea goes like this. He says, when you see AI, replace it with the phrase cheap prediction. And the reason to do that is it really cuts through the magic and kind of inscrutable nature, the black box nature of AI, and puts it in plain English. And so when we're talking about understanding AI in healthcare, let's do that exercise and just substitute AI for cheap prediction. So we're talking about understanding cheap prediction in healthcare. Really simple concept, plain English, we all can understand that. So with that new lens, let's dig in and take each of those words and dig into a little bit of detail on cheap and prediction. So let's start with the cheap side. Now, some of you maybe have a bone to pick with this cheap aspect. You maybe have investigated AI. You maybe are looking at significant cost to go and do this within your organization. And there's an element of truth to that today there are some barriers to that cheap aspect of prediction. And so let's dig into what those are. So the first aspect we see, if you're doing AI from scratch, where you're really building a team who's going to be doing data science and training models, the model training and prediction itself, we see as relatively low cost. Why is that? A lot of that software is free, open source. The algorithms are very commoditized at this point. And the research community is really good about making those new innovative approaches free and open via open source software. So that's not where your costs would come from. Your costs are going to fall into 2 big buckets. First of all, for data science folks, it's a specialized resource. They're in high demand and they're relatively expensive. You need folks to go do that work. And then not insignificant is your data infrastructure and managing all that data. People say machine learning is all about algorithms and data, but mostly data. And there's a lot of truth in that you've got to get your arms around that data. You've got to get it in one place. You've got to unify complex data sources before you can go and train interesting models. There is good news in all this, though. If you look at what's happening and trends in the industry, what you see is that there are huge investments being made to overcome these hurdles. Folks like CB Insights say that over 26 billion was invested in AI startups last year. You can see from the graphic in the middle, the laundry list of startups and even mature companies in the healthcare space, particularly, that are working on AI. So you see tons of money pouring in to really bring down a lot of these costs. What does it mean for people who are navigating the landscape? It goes like this. With trusted AI partners, you have the ability to capture a lot of those investments and bring down your costs. Approaches like pre-trained models or platforms that train models on your data can help you cut a lot of that data science labor costs, as well as decrease your model training costs on top of that. And then you can shift a lot of that data infrastructure and management cost onto partners. So as you think about navigating this landscape, you want to think about, how do I take advantage of all this money that's pouring into the industry? How do I work with trusted partners? And we see really the only largest of the large organizations are going to be doing AI from scratch, where they're building up large data science teams, data engineering teams, and doing that completely on their own. We see many folks in healthcare working with trusted partners. All right, so we talked about cheap. Let's now dig into prediction. It might seem kind of silly to define prediction and kind of break it down for such a simple term, but I think you'll find this instructive. So what are we talking about? We're talking about going from information that we have, using prediction to generate information we don't have. Really simple, right? But let's make this concrete. When we talk about information we don't have, what is it? Well, mostly what we think of is we think of clinical aspects like scores that predict risk in certain disease areas. And many of these applications come to mind. There's been a lot of visibility around use cases like, let's take an imaging study for something like breast cancer, and let's use AI to predict whether a certain cancer certain lesion is cancerous or not, and to augment radiologists. Or other cases where we take EMR data and we make predictions around who's at higher risk of certain disease conditions. Maybe it's chronic conditions like COPD or CKD. And this is really what initially comes to mind when we talk about AI in healthcare, are those clinical aspects. And there's been some great work and research done in those areas. But one important thing to take away from today, and this is one of the big ones, is there are aspects beyond clinical where we see huge impact coming from application of AI. The big one that we see is around behavioral analytics. And this is all around, what's the likelihood of patients responding to outreach or nudges across various journeys? So this is digital engagement powered by AI. There's a huge opportunity to apply this. Many times in healthcare, we already know what the patients are diagnosed with, but we need to get them to do things. We need to get them to come in. We need to get them to have screenings. And we need to use outreach in this intelligent way to actually drive those behaviors. So we see massive opportunity in that area. And then another one we shouldn't forget is operational. Things like predicting the likelihood of appointment no-shows, forecasting operating room capacity are great applications of AI, and we see those taking off. So let's take those three areas and let's think about how we prioritize those. As a decision maker, you'll have some choices about where to apply this technology. And here's our take on some of the forces that'll guide you. So one big force that we see is a technology force. AI, this fundamental capability and the economics around it, really decreasing the cost of prediction, is a huge force that's going to result in every industry, including healthcare, using many more predictions. So that's one big trend. Another big trend that's specific to healthcare are market forces, things like competition for healthcare consumers, new entrants like Walmart and CVS, along with preventative focus, ACO, and value-based models. And the result of that is going to be this need to influence and manage patient relationships. And we see those two forces combining to yield this conclusion. We believe the healthcare industry's big initial use, the one that's going to be widespread, is to apply AI not necessarily directly to clinical aspects, but to digital engagement, reaching out to patients and managing those relationships in a smart way. And you'll see how we can actually blend in some of the clinical work in this as well as we go through some examples. So let's actually take one. To make it concrete, let's take something like breast cancer. So there are emerging systems that take in data from lots of different sources. Here you see on the left side, things like EMR data, pop health data, data from the call center, along with marketing automation systems, payer data, really unifying all those data sources, and then applying things like business rules, prioritization, personalization, where some components of that is powered by AI and models that are making predictions. And what is that all meant to do? That's all meant to take for an individual patient, here our example patient for someone like Judith, and identify not only what the relevant actions for her might be, but also to rank and prioritize them so we can come up with a next best action. In this case, the top thing that we recommend for her is a mammography. And let's dig in a little bit beneath the surface of this high level view and talk about how we drove some of those predictions in this example. In this case, a machine learning model like a breast cancer model is taking in clinical data, things like features you see on the bottom right, everything from vitals like BMI, lab order results, family history, meds like prescription data, and making predictions around her relative risk. And we can assess the model performance with things like AUC scores, which we're going to explain in sessions 2 and 3. But in plain English, a model like this can really highlight which patients are at higher risk, and we can assess those models and say, for those folks in the top 5% of scores, they're 15 times as likely to develop breast cancer in the next year. So we should really be prioritizing our outreach to them. And when we compare against baseline performance of some traditional gold standard models like the Gale model or Trier-Kruzik model, you can see that on metrics like AUC, these modern style machine learning approaches far outperform. And so we can tie this all together into digital engagement that is smart, that is personalized, and that can have a big impact on patients' lives. So let's now switch gears and talk about making this relevant to you. Let's talk about forming up your strategy. And we have a specific recommendation on how to approach this. And it goes like this. We recommend starting with what you want to achieve in terms of your organizational objectives and working backwards. And so let's take a high level example to start. Let's say you want to drive utilization in service lines, and that's really one objective that you want to dig into. And now let's work backwards. The next step is going to be, all right, well, what predictions are going to help drive those objectives? And notice that here, you don't need technical knowledge. You can brainstorm and you can make your recommendations around, if we could predict risk of certain disease conditions, if we could predict likelihood of engagement, we can go drive activity and help utilization. So you don't have to be technical to run this exercise and talk about what predictions might support those objectives. And then the next step, you want to keep working backwards and you want to talk about, all right, well, what data would support those predictions? And in this step of the process, you do need a little more knowledge. We're going to cover that in sessions 2 and 3. And we'll teach you some fundamentals on how to understand how data maps to model training and predictions. But in this case, you can see you may have clinical data that comes out of EMR or claim systems that will support models that predict clinical propensity. You could have interaction history like past campaigns and outreach and engagement that have models that predict likelihood to engage, and content effectiveness and channel recommendations and time of day to maximize your outreach. So you can kind of put together all the pieces of the puzzle. And what you can do is you can take this approach and you can actually iterate it on it to get deeper and deeper. So we have a high level view here. Let's do one more iteration and actually go down to the mid-level view, and we're going to drill in. So let's say we want to increase utilization in some specific area. Let's say we want to drive bariatric surgeries. We have a target metric. All right, well, let's now talk about what predictions are going to support that. Well, we want to have models that predict clinical propensity for bariatrics. We'd want to have past history of engagement and predictions around what content is going to be most effective, what channels are most impactful, and timing around that. And then, of course, we want to have data sources that support that. Interestingly, you see an arrow here that wasn't on the last slide. We see the engagement piece of this needs to be informed both by interaction history as well as the clinical side. You want to know what outreach not only caused people to open emails or click through, but actually resulted in people showing up for appointments or getting procedures. And so in healthcare, we see specialized systems that are taking in both that interaction history and clinical data and training models on that combined result. So let's kind of wrap this up and talk about the generic strategy process. Based on the examples you saw, we have this 1, 2, 3 type approach. We first targeted our objectives. We listed out predictions that are going to support those objectives. And then we found data sources that are going to support those. There is one more step that we recommend, and that is you need to describe how this is going to get put into operation. There are areas that are quite straightforward to model, and a great example of that is something like predicting patient no-shows. That data is inherently labeled, and in session 2, you'll understand what that means, in that data is very ready to be trained in terms of which patients are more likely to no-show versus ones that are likely to show up. But when you think about how to put those predictions into practice, you have a bunch of decisions to make, like, what are you going to do? Additional appointment reminders for patients who have higher likelihood to no-show? Are you actually not going to do extra patient reminders, but you're going to do things like double booking? How do you recommend in your workflows that double booking? Some of those predictions are challenging to put into operation. For outreach, we find that that tends to be straightforward to put those predictions into campaigns and outreach, and that tends to be low-hanging fruit. So that's the process that we recommend. We actually have a great PDF takeaway that summarizes this process, also has a really simple worksheet to help you work through this process and apply it within your organization. So the next topic is a really important one. We've been spending a lot of work in this area, and Chris, a credit to him, he's been a leader for us, leading a cross-functional team, doing a lot of work in how we address bias and avoiding harm in AI. And really, he's emerging as a leader in the industry. So credit to you, Chris, for all the great work there. I'm going to turn it over to you to take us through this.
Joe, I appreciate the sum up, the simple way that you've explained this stuff and some of the materials that you've helped to help understand these concepts. So we're talking about strategy. We want to just dig a little bit deeper into the kind of future that we're trying to help healthcare leaders be able to create. There's a lot of issues. There's a lot of harm that can come when healthcare leaders aren't asking the right questions about what AI can do, about what the impact is on ethics and equity, or even in scenarios where there are partners or vendors who kind of don't focus on these issues or sweep these things under the rug. There are some major challenges that arise. Example is that, and we're looking inside and outside of healthcare here, but in this example, this was a recidivism algorithm. It was an algorithm to predict how likely somebody was to commit a crime after they have been imprisoned, and it falsely flagged Black people at twice the rate that it falsely flagged white defendants. So that's an example of harm that could arise when the right questions aren't being asked. Another example, this is really recent. If you were following Apple's release of their credit card last year, they partnered with Goldman Sachs to develop the credit scoring algorithm there. And like we acknowledge both Apple and Goldman Sachs as some leading institutions, but they're absolutely not free from these challenges that can arise from bias and not asking the right questions, not doing the right development or handling of imbalanced data when it comes to AI. Another example is directly within what we do in healthcare. If you've seen some of the news coming out of Stat News over the past couple of months, this is a really hot topic in terms of racial bias being detected in algorithms that are used to predict clinical likelihood or how sick certain patients are. So that leads us to a question. Are leaders out here, why would leaders knowingly commission and release racist algorithms for use in the market? I'm not necessarily sure that that's the case. If we hop onto the next view, what we see, like the way that we view this is that if handled correctly, there's actually a big opportunity to have a positive benefit using AI algorithms. So we argue that very often leaders don't know the potential ethical pitfalls of these algorithmic approaches. So this is the type of future that we're trying to help you avoid. Algorithms, as Joe described, they look for patterns in data to make decisions about how to engage patients, what those predictions are. So those can be focused on what's likely to have what illness or who's likely to respond to which campaign. But the crux is, because they're using past data, then those outputs, without being properly handled, those outputs are going to reflect those past biases in that data or in the business processes that led to the generation of that data. There's a silver lining here, which is that there are proper ways to handle those imbalances and identify those differences and disparities in the populations reflected in the past. So handled properly and modeled correctly, we move away from the scenario of just repeating past processes and past social failures and really patterning our engagement and outreach in a way that should be reflective of our markets. So as you see in this guide here, leaders should be asking about things like race, gender, social bias potential, and differences in models before using them. What we're doing this for is to equip you with the right kinds of questions to ask and the right tools to evaluate. An example that we'd like to share is a model visibility guide that highlights how a model is built, what data was used to train it, what data informed it, and the social biases that it uncovered, and ultimately how to mitigate those biases. In healthcare, we think that the focus should be on transparency, that there is no room for the secretive black box / secret sauce style approaches that have led to some of the challenges that we discussed on the previous slide. And as a healthcare leader, you're the difference between whether AI reinforces those past biases that were highlighted or helps healthcare do good for the underserved and the undertreated. Now, to wrap it up and summarize what we've learned today, I'm going to hand it back over to Joe.
Yeah, thanks, Chris. And that work is really important. I think our team has been excited to dig into some of those bias and fairness issues. I'm really, really proud of the team, and credit to you for leading a lot of those efforts. So let's talk about what we covered today. So we introduced this new lens, viewing AI as cheap prediction. Again, plain English terms, really understandable and approachable. We talked about the investments coming into the industry that are helping to bring down the cost to implement AI and that are already driving adoption and are really going to accelerate that. We talked about applications in AI aren't just focused in clinical areas. There are other things around the behavioral analytics side and digital engagement where AI is going to have widespread use very quickly. And then we talked about how it can increase patient engagement and those aspects that can really bring AI for good. There is a huge opportunity to be proactive, to take this data that's been sitting out there to really understand risk based on data and to put it into practice, but you do have to navigate those tricky bias issues as you do that. So with that, let's look ahead to our next session. We're going to get more detailed as we go. We're going to talk about AI and machine learning and the differences and really help you understand what machine learning is so you can have a good framework. And then as we go, we'll do session 3 and 4. Note on timing, session 2 is exactly a week from today. And then we'll take a break for Thanksgiving and do session 3 and 4 after the Thanksgiving holiday. I think we do have time. Chris, should we open it up for a quick question or two?
Absolutely. And fortunately, we've already got some active participation from the audience. And I wanted to start with Ellen Doxey. And I have an opinion on this, Joe, but I want to hear yours too. Do you have a feel for current consumer opinions on AI in healthcare? I'd imagine that some might feel that their privacy is being invaded if their personal health data is used for marketing efforts, especially as it gets more sophisticated and personalized.
This is a fantastic question. So my opinion goes like this. I think today the industry is very cautious about this. And if you look at from our own experience, as we do outreach with our clients, we put out messaging that is very approachable, that is not scary. We're not saying you're going to get cancer. And in fact, I think we can turn the dial up a bit from where the industry is today. And I had a great thing that happened to me recently that really, really struck home. I had a recall for some part in my car. It was like a passenger side airbag. And I've been busy. I ignored the recall. I didn't do it. And those people hounded me like crazy. They called me. They sent me direct mail. They were on me to get this taken care of, like you couldn't believe. Yet in healthcare, where we might have really serious disease risks, you just don't see that type of focus and urgency. I think we're not going to go that extreme where we're really going to the other end of the spectrum, but I do think we're going to start to move that dial where we do start to indicate someone may be at greater risk of certain conditions, that we really want you to come in for that reason. And we want to kind of match make those people that we know there's some risk about with the health systems and get them engaged.
Thank you, Joe. And to add on just a little bit to those thoughts, there's basically two kinds of risk. Are you reaching out to me for the right reasons, or are you reaching out to me for the wrong reasons? And I think that a lot of trust that diminishes a lot of trust when advertising communications, when experiences aren't personalized to me or personalized to individuals. The more of those kind of irrelevant communications that people get, the more it diminishes their trust in a leading healthcare institution. A lot of conversation that we've had too is kind of where we actually view marketing within the delivery process and within the healthcare delivery process, because the thinking is that with healthcare education, with your knowledge on your situation being an important part of your healthcare, perhaps we should, as marketers, as people engage in patient engagement and outreach, perhaps we should think of ourselves as kind of like that first line where people are like identifying issues and challenges with their healthcare and making decisions about how they manage. We like to view marketing as part of that delivery process, and we wanted to make sure that the future communications are trusted and relevant for those patients and consumers. Unfortunately, this puts us at time. Thank you, thank you very much, Ellen. That was a fantastic question. We'll have a teaser question. One of the questions that came in was related to, hey, how do we know that this AI approach is successful or outperforming other things? We're going to, of course, go deeper on that in model performance. But Joe, do you want to handle that one on, hey, okay, so I've got some different solutions I'm trying here. How do I know that AI is actually outperforming the traditional approach?
Yeah, it's a great question. It is exactly the right question. And we want to answer that with data. We really want to have the metrics in place to measure that performance so that we have confidence that it really is doing what we want it to do. And we'll talk more about the specifics of that.
All right, fantastic. Well, everybody, we appreciate you staying on with for this learning with us. We hope that you got a good introduction to the technology, strategy, business cases, and the ethics behind these decisions. If you have any questions or you want to discuss anything with us, feel free to reach out. LinkedIn is the easiest place to find us or follow us. And you can always hop on over to our website if you're looking for other weekly content that we have, such as healthcare financiers and marketers and data scientists that talk to us every week on our LinkedIn live sessions. Sign up for our newsletter and we'll keep you informed on that stuff as well. But with that, we appreciate you and thank you very much for your time on today's webinar.